Hello friends and welcome back to my channel Malik Helps. So today's video is about the social medicine again. Yesterday we were talking about social medicine, a lot of things. The thing which is one more important thing to remember is the number of beds in the social medicine. So I prefer to make a separate video over number of beds. I have taken the direct question from the KROK exam, and let's highlight the main key concepts for the number of beds. So here is the first question. So the question simply says that in the inpatient gyno department there were 6500 women who underwent for the treatment, and they spent a total this much bed days. So what indicators of the gyno unit will need to calculate the data? So the answer simply, if you want to remember simply, the question states inpatient, so mark the answer inpatient. So average length of inpatient stay, so no need to understand too much, just remember it. The inpatient department, the answer will include the inpatient stay as well. Another same question, or let's say similar question, they are asking about the what work indicator of the inpatient ward can be calculated based on this data. So the data is annual report of an inpatient ward presents data about the number of patients, days, and the number of patients who have undergone treatment within a year. The question itself says the inpatient, so use the word inpatient is in the answer. The answer will be average duration of inpatient treatment of a patient. Next is, now you can do mistake, because I have done this mistake as well, that's why I highlighted it very well. So there is one question in which inpatient again is there, but we have to take care of the things. Let's understand it a bit so that we don't mark it incorrect. The question says the inpatient care provided to the population of a certain district is being analyzed. What indicator should be used when deciding whether to reduce the number of beds available in the hospital? So they are thinking about reducing the number in the hospital. So for that, what do they need to know? They need to know that how many patients were registered in the inpatient department in the whole year. So they need the average annual bed occupancy. So just remember this thing, I have highlighted it as well. So they want to reduce the number of beds. They need to know average annual bed occupancy. For that, just read the question one time, that not every time you have to mark the answer inpatient when you see the inpatient in the question. So this is the only atypical question for which you have to just read the question. Let's go next. Next is a simple thing. A decision was made to decrease the number of bed in the inpatient department, and installed, and they opened the daycare units within the partial hospitalization in the city polyclinics. The main goal of this decision, so they reduced the number of bed in the hospital and opened the daycare unit itself. So they did something good, that instead of keeping the patient in the inpatient department, the daycare units will be more helpful to for the early diagnostic of the things, that the patient will come in the daytime and get the best help is the early diagnostic itself. So what they did is they reduced the number of beds in the hospital and put some doctor outside the hospital in the daycare unit. So they did the rational use of funds. You are watching my video right now for yourself, so you are using your time as rational use. So you are doing the rational use of time. So the same way, when they opened the daycare units, they put some doctors in the daycare department for the early diagnostics, and they did the rational use of beds funds. Now the last question, last but the least, at year-end, hospital administration has obtained the following data: annual number of treated patient and annual number of the patient used bed. So there is only one question which asks about some sort of index. What index of the hospital work can be calculated based upon this data? So I have made a technique for it so that you don't mark the incorrect. When you see the word index, so we can make a B with the word X. So the answer starts with B. Just remember, just so you know, that the word with the word X, we can make the word B. So the answer starts with B. So these questions are so tricky, we might forget something. Watch this video on 2x speed for 3 times. So you will remember the things forever. This is it with this video. I hope you would remember such questions, and comment me in the comment box if you still want to understand something from these questions, or comment me in the comment box about your mistakes or whichever the topics you find it hard to understand, difficult to remember. And this is it. So today's quote says that never forget to enjoy your life in the course of medicine. So med students needs the rest as well, so never forget to enjoy your life in the course of medicine. Thank you so much, have a nice day. Wait for the next video, more content is loading for you. Have a nice day, bye.